Let's go through the electrocardiogram, the practical aspects of electrode placement and patient preparation. So we use a mind map to help us recall and remember how this procedure is being done. So first, you focus on patient preparation. So you explain the procedure, you briefly explain the test to the patient, addressing any concerns to reduce anxiety, which may help minimize artifacts like tremor and movement. The positioning also comes in still with the patient preparation. Um, you ensure patient comfort, you ensure the patient is lying supine on an examination table. And with relaxation, as the patient to relax, breathe normally, and avoid talking during the recording. Limb position too is very important, where the arm should be slightly away from the torso to prevent electrode contact with clothing, which can distort the tracing. And also with skin preparation, cleaning, abrasion, and drying. With the cleaning, you clean the electrode sites with an alcohol swab to remove oils, sweat, and dead cells, skin cells, and abrasions. If necessary, gently abrade the skin with a small abrasive pad to lower impedance, especially in patients with thick or hairy skin. And with drying, you ensure that skin is completely dry before electrode application to enhance adhesion and signal quality. So the equipment and lead system setup, ECG machine check, and also checking the electrodes are very important. So with the machine check, you confirm that the ECG machine is well calibrated and is functioning properly, and you verify the cables and the leads are intact, clean, and free of deficit. And with the electrodes, you use disposable or reusable electrodes with conductive gel, and you ensure the electrodes are compatible with the ECG system. The standard 12 lead electrode placement, the limb leads the right arm, place the electrode on the right forearm or wrist, and ensure it's placed away from large muscle masses to reduce noise. With the left arm, you um, place the electrode on the left forearm or wrist, monitoring the right arm electrode. And with the right leg, you place the electrode on the right lower leg or ankle. So this electrode is commonly used as the ground reference. With the left leg, you place the electrode on the left lower leg or ankle. So these ones, they all have their peculiar colors, which from the right arm, red, yellow for the left arm, and green for the left leg, and then black for the right leg. This is the ground reference. And with the precordial chest leads, follows the same: red, yellow, green, brown before black. Yes, so that is, and then purple or violet. So with the V, you position the V1, the precordial chest leads, the V1. You position it in the fourth intercostal space at the right sternal border. But remember, there's white attached to all the other colors: so red, white, yellow, white, green, white, brown, white, and then black, white, and finally the purple or violet, white. So V1, you position it in the fourth intercostal space at the right sternal border. For V2, you position it in the fourth intercostal space at the left sternal border. V3, first V4 is easier to note, so you position it in the fourth intercostal space at the mid clavicular line, and the V3 is equidistant to it, so you place it midway between V2 and V4. And then from the position, you place the V6, which the V5, actually the V6 is at the mid-axillary line at the same level of the V4, V5. So you place V5 at the same horizontal level as V4, but at the left anterior axillary line. When it comes to placing or tips for accurate placement, you have to look at the landmarks and use our anatomical landmarks like the sternal borders, the intercostal spaces, the midclavicular line for consistent and reproducible electrode placement. With the electrode alignment, you ensure precordial electrodes are aligned horizontally to accurately capture the heart's electrical vectors, and you avoid interference. So you have to ensure the electrodes elites do not cross or twist, and this may lead to artifact or inaccurate readings. With the special considerations, look at the patient's variability, motion artifacts, and environmental factors. For the patient variability in obese or muscular patients, additional skin preparation may be required. In the cases where the standard positions are challenging, for example in chest deformities, alternative placement may be used while noting deviations from the standard lead positions. For the motion artifacts, you remind patients remain still and avoid deep breathing or talking during the recording. And with environmental factors, minimize electrical interference by ensuring the ECG machine is not near other electrical devices that could introduce noise. Troubleshooting common artifacts like with poor skin contact, you just reclean or reabrade the skin. You check electrode gel and replace if necessary. With motion artifacts, you reposition the patient and instruct them to remain still. With the baseline drift, just check the electrode placement and cable connection and adjust the filter settings if needed. The documentation, you record the details, you document the date, time, patient position, electrode placement specifics, and any deviations from the standard protocol. And with the interpretation aids, you note any factors like patient movements, electrode issues that could affect the ECG interpretation. So in summary, preparation is very important. Where you clean, abrade, dry skin, explain the procedure, position the patient appropriately, and then electrode placement. You follow the standard placements of the lymph and the precordial leads, using anatomical landmarks, and also quality control where you monitor for artifacts, ensure proper equipment function, and you document any other issues.